Our healthcare system is the most expensive healthcare system in the world. We spend twice as much as any other advanced industrial country in the world on our healthcare, and we end up covering fewer people than any other country. We have 20 million people left in this country who have no health insurance whatsoever, and another 50 million or more who think they have health insurance until they try to use it and they find out that the insurance is so insufficient it's not enough to keep their family out of bankruptcy or financial catastrophe. On top of that, even though we spend twice as much as the rest of the world on our healthcare, the outcomes that we have from our healthcare system are worse than anywhere else. We rank number 34 in international standards of healthcare. Our children are sicker, our babies die more frequently, mothers die more frequently in childcare. We have a higher rate of mental health and addiction than the rest of the world. For working class Americans, we are trapped in this screwy system that links healthcare to employment. So you lose your job and you lose your healthcare. Your kid ages out and your kid loses their healthcare. You go on strike, you lose your healthcare. You get sick, you often lose your healthcare once you run through whatever extensions are available on the job. So sick people, the people who need it the most, often lose their healthcare. And costs for employment-based healthcare have gone up every year since the 1990s, and the percentage that workers have to pay for their health care has also gone up every year since the 1990s. They are shifting the cost of the healthcare system slowly onto the backs of the working class. And that's why healthcare is the biggest source of strikes, the biggest source of lockouts, the biggest source of concession bargaining for union workers. The big problem with our healthcare system is in this country, we look at healthcare as a commodity, something that you purchase and that is geared to generate profit for the people who own the various aspects of the healthcare system. The rest of the world has learned that you have to look at healthcare as a public good and a public service, that you have to treat healthcare the same way that we treat education and firefighters, fighting and highways and libraries, that it's a public good that we all have to collectively fund and that we all draw from when we need it, based on the fact that we are citizens in a free society. So the first thing we have to do is understand how this system works and understand that as workers, when we take healthcare off the bargaining table, we'll be able to move forward and really advance our other concerns at the bargaining table.